First of all, welcome everyone for this EUPSA webinar on artificial intelligence. So this is a very timely topic, and for this topic we decided to go with people that know what they're talking about. Dr. Keijzer will then be introduced later by Professor Lacher. Is in fact just gave recently a lecture about artificial intelligence at the ISPSR meeting in Milan. But it's really my pleasure to also have a good friend and colleague of many years, that is Dr. Retrosi. Our friendship goes a long way back. From Giuseppe is originally from Rome, from Italy. He in fact trained at the Catholic University of Rome, the Sacred Heart in Rome. Completed a pediatric general surgery residency at the Gemelli Hospital. But then, as I did, also he went abroad and worked as a research fellow, and then afterwards as a clinical fellow in several hospitals in London, England, such as Great Ormond Street and St. George's Hospital in Chelsea, Westminster. And during this time, Dr. Retrosi completed a master's in surgical education at the Imperial College in London, then improving his teaching skills and learning how to apply educational theories to surgical training, which is definitely something that he's very passionate about. In 2015, he went back to work to Rome, but then shortly after he joined, in fact, us in Toronto, completed an ICU surgical fellowship at Sick Kids Hospital, where he got extra training on neonatal surgery here at the University of Toronto. And then after this fellowship, he then joined the faculty in Winnipeg, Mannitoba, where he's appointed as a pediatric general surgeon and assistant professor at Health Sciences Center, the Children's Hospital of Winnipeg, University of Manitoba. Is enrolled in a 15-month certificate program in artificial intelligence. So there's a lot of people that talk about artificial intelligence without having studied the basics of it, but is actually doing, as I said, a program at the Institute of Education, UHN here in Toronto. His interests from a clinical standpoint are minimally invasive surgery, neonatal surgery, and then from a research standpoint, surgical education, artificial intelligence in healthcare, and congenital anomalies. So without further ado, please, Giuseppe, really excited to have you, and look forward to hearing your lecture about artificial intelligence.
Thank you so much for the very kind introduction, Augusto, and my pleasure to have the opportunity to present on this topic today. Just going to share my screen. So it's a topic that I'm studying, as Augusto said, and I'm very happy to talk about it today. I have nothing to disclose. So here my learning objective. I hope that at the end of my presentation, the audience is going to be familiar with the basic on the artificial intelligence learning methods. I hope you're going to get an idea how to develop an artificial intelligence project in healthcare and in pediatric surgery, as well as having an understanding how to apply artificial intelligence and use the multiple application in pediatric surgery and in healthcare, generally speaking. So let's start with try to define what artificial intelligence is. You can find several definitions online, of course. I decided to start with the John McCarthy one. John McCarthy is a professor of computer science at Stanford University, and is the first one that in 1956 used the term artificial intelligence. He defined like the science and engineering on making intelligence machine, especially intelligent computer program. I think it's a pretty good definition, but I want to play a bit with the most popular large language model nowadays, ChatGPT. and I asked ChatGPT what artificial intelligence is. And basically said that refer to the simulation of human intelligence in machines that are programmed to think like humans and mimic their action. So this pretty broad kind of definition. However, we can't speak of artificial intelligence without mentioning the name of Alan Turing. Alan Turing was the first one that in 1950 started to think about a machine that can think, an intelligent machine. I think probably most of you know this name for the movie The Imitation Game with Benedict Cumberbatch and Keira Knightley. Where basically, also the title of the movie is basically the title of the first paragraph in his work that he published in 1950. So in this paper, he tried to answer the question, can machine think? Shortcut is say yes, but we have to keep in mind that they cannot think like a human being, but they can think in a different way just because they are machine. So Alan Turing became famous because he realized what is nowadays known as the first Turing machine, that is a sort of whole kind of computer. He used this machine to decode the Enigma code during the Second World War. And this kind of machine is what we can define nowadays a rules-based expert system. These are artificial intelligence machines that are still using nowadays. They are based on preset rules that when we preset this, they are able to perform tasks. In this case, the machine was able to decode the Enigma code. These kind of machines are good, but they got a problem. They are static. Every time that the rules change, we have to reset the machine again. So in fact, for the Enigma code, the code was changing every day, so they needed to reset. So basically make this kind of machine very static and not be able to adapt to changes. However, nowadays we live in the big data era. So this means that every day, any kind of industry, including the healthcare system, is producing a huge amount of data. So this is what made artificial intelligence so popular today. With the introduction of machine learning, so basically with a subset of artificial intelligence that is able to learn directly from data without presetting rule, basically we are able to create a very dynamic system, machines that are able to learn directly from the data and are able to adapt to the changing. Let me clarify a bit of terminology, because nowadays artificial intelligence, machine learning and deep learning are used pretty much like synonymous, but there are some differences. Definitely artificial intelligence is the broadest concept among the three, that basically based by machine that are able to perform tasks that normally need human intelligence to be done. In that we have machine learning, that is a subset of artificial intelligence that use algorithms that, as I said, are able to learn from data directly, are able to generate the knowledge directly from the data, and able to perform prediction and perform tasks from this knowledge. And that we got probably the most exotic part of artificial intelligence, the deep learning, that is rely on complex algorithm called artificial neural networks. These algorithms are able to perform very complex tasks, such as image recognition and even the natural language process and speech recognition task. Just to give a simple analogy, we can see the artificial intelligence like the human body. The machine learning is going to be a sort of nervous system, and the deep learning is going to be the brain, the neural network in the brain. But how a machine can learn? So nowadays here we got three different kinds of learning methods. The supervised learning, the unsupervised learning, and the reinforcement learning. There is no one that is superior to the other, but everything depends from which data do we have and which task we are dealing with. So starting from supervised learning, in this kind of learning, we label our data. So we feed the machine with data that are already labeled. And this is a good learning method, especially when we know what we are looking for. Let me do a practical example. Let's assume that we are aiming to realize a model able to recognize pneumothorax on chest X-ray. So in this example, we know the signal, we know what we are looking for. So what we have to do, we need to realize a training set with the data that we have and a test set that to validate the model. In the training set, basically, we are going to label all the X-ray with pneumothorax and all the X-ray without the pneumothorax. We are going to feed this training data into the machine. The machine is going to learn what we are looking for. And after, when we're going to test the machine with the test set, we should be able to see the prediction and how well the machine is performing. Very important here to keep separate the data from the two sets. We cannot use the same data for both. We need to have different kind of X-ray in the two sets. Very important the amount. So normally it's not a fixed rule, but normally we have to use about 80% of our data to train the machine, and that about 20% is what we use normally for testing and validation. Another learning method is the unsupervised learning. So in this case, we use unlabeled data, and this kind of learning is very good when we don't know what we are looking for. Means it's very good to look for cluster or patterns among our data, and basically it's very good to define patients that have got a high risk factor for developing a kind of disease or a kind of condition, and it's a bit more difficult to define here the training set and the test set. But basically what we do, we are gonna feed into the machine all the data that we have, like the labs that we have from the patient, the demographic that we have of the patient. We can insert all histology information and radiological information. And the machine basically is going to elaborate this data. It's going to separate, it's going to find cluster of patients and come out with an outcome to perform the task. Last learning method is a bit more difficult to explain. It's called reinforcement learning. In this case, what's happened? The machine, the agent, learn from actions. So the agent acts in an environment, take action, and after receive feedback based on the outcome of the action. If the outcome is good, it's going to get the rewards. If it's not good, it's going to get a penalty. And from this, basically, the machine learn based on the feedback. This kind of learning method is really useful, especially in healthcare, to help out in the decision-making process. Another important concept for artificial intelligence is understanding about underfitting and overfitting. Here we got a regression classification example, but when we develop a model, we need to make sure that the result is without bias and is performing well. When we have an underfitting example, means that probably the model that we choose is too simple to elaborate our data. And And this is a model that normally leads to have bias in the result. They normally perform very poorly on the training set and very poorly on the test set as well. However, when we have this, we try to make a bit more complex our model to adapt better the model to our data. But there is always the risk to overfitting, and so the signs of an overfitting is when we have a model that is performing very well on the training set, because basically is including all the data that we have, even the outliers one that are normally not so important, and they might lead to a poor performance of the model. But when we move to the validations part, when we test the model, normally even if it was performing very well on the training set, we're going to get very poor performance in reality. And after this, probably the most popular part of artificial intelligence, the deep learning, is by far the part of artificial intelligence that is making this new technology so popular. This subset use artificial neural network. An artificial neural network is basically an algorithm that really try to mimic the human brain. It's done by nodes over here. And let me just put the pointer. So several nodes, and each node is connected with what we call in artificial intelligence parameters of weight. So this is a simple example of neural network. Normally we have an input layer, we got an output layer, and the hidden layer in between. So this kind of algorithm can become very complex, and we can add a plethora of hidden layer. And in this picture on the right, so where we have more layer, we basically got the deep learning. So it means that higher is the number of hidden layers, deeper is the learning that we're going to get. Of course, we are going to increase the complexity of our model. The convolutional neural network is among the artificial neural networks, definitely the most important one nowadays. Is the one that is mainly used for image recognition and face recognition, analyzing video. It's also involved in the car automated driving from Tesla, probably. How does it work? We feed into the input layer an image that, of course, is going to be done by pixel, and each node is going to elaborate, and it's going to transmit a signal to the next layer. And after it's important, there is an activation function that is basically is going to kick it in and fully activate the next layer, like a cascade. This is a feed-forward neural network that each node is going to analyze details of the image, and is going to put all the information together until we can identify which images we're deleting. Just to be a bit more clear about that. So each node is going to focus on a filter or a kernel of the image. So basically that is a single detail. Like in this example, the first layer start to analyze the different kind of color, to move to identify and focus attention on several details of the image that a layer can focus on the shape of the hair, on the shape of the shoulder, on the shape of the eyes. And after all these details, they're going to convolute together towards the end of the neural network to come out with the output and to identify this like a human being in this case. So I hope I give you a broad understanding on how artificial intelligence works, but it's also important to focus on a more practical aspect of the topic. And here I reported the machine learning pipeline in healthcare. This was published by David Singh and this group 3 years ago. It's really important to understand this part, to know how to develop a project and how we can use artificial intelligence in our field. There are some crucial steps. So definitely the clinical use and the case design is very important. We need to start always with the gap analysis, sort of what we do for a quality improvement project. Actually, artificial intelligence at the starting of the project is pretty similar to quality improvement. We need to identify a need, something that is missing, and we need to identify the actual situation and understanding what we want going forward. When we start with this step, the next one, and this is the most time-consuming part of artificial intelligence project, is data acquisition and preparation. In computer science, people like to say garbage in, garbage out. So if we do not start from high-quality data, we're never going to get a good result, even if we have a very complex and advanced model. This is going to take probably 80, if not even 90% of the time on the preparation, because time spent on cleaning data, dealing with missing data is pay a lot after at the end. And after, a lot of people focus on model development. That is probably the technical part, like decide which algorithm to use, if it's worth to do artificial neural network or other models. The reality, of course, we need to have an expert in computer science, but this is probably about 10% of all the process, especially nowadays that there are a lot of open sources from giant like Google, Amazon, that you can have TensorFlow from Google or Surgeon Makers from Amazon, that you have already basically modeled there, that already built it up, and you can just train with your data. And after, it's very important to already engage at the beginning of the process several stakeholders that are going to use our model, especially to think about the validation part and the final clinical integration in the workflow. At least, but not less important, there is a non-technical part in artificial intelligence, like the legal, ethical consideration that we need to deal with, that especially dealing with the data from healthcare that are high risk of breach confidentiality and privacy of the patient is something that we need to start when we start with the case design, because that is gonna we have to adapt and making a lot of consideration along the way. When we decide to realize a model, we have to decide if going for a in-house model or a cloud model. This means we need to decide if our institution, ourselves, we are going to deal with all the aspects of the project, or if it's worth it to basically use a cloud model and use product from big companies that are already leaders in this field. There are pros and cons in each approach. Of course, the in-house model is a bit more costly and needs a lot of local expertise and local talent. But from a privacy point of view, it's probably a bit more efficient because we don't have a lot of data that are going to share outside our institution. However, if the institution is not a data-driven institution or is not ready for artificial intelligence, a good option to start and to be involved in this kind of business is to use the services from a company like Microsoft, Google, and Amazon. These companies are already into the healthcare business. I know for sure in Canada, Microsoft and Google are already compliant to Health Canada in terms of regulations. This kind of company can give you support at a different level, like can take over completely, like giving you infrastructure, software, and maintenance, or you can just use them for a portion of the project that you're going to do, and using the cloud to share data and basically to avoid all the data only on one device and using them to care about maintenance. Of course, when we go for this option, we cannot customize our tools and our product too much, because this has to be done for a much bigger market, while with a in-house model, you're definitely gonna have a bit more customization. Very important to have a multidisciplinary approach when we are dealing with developing artificial intelligence project. We are clinician, we are probably the first point in the chain, but it's important for us to acquire a sort of knowledge and language in this field, basically to be able to speak with computer scientists and data analysts that are the expert of the tool, but they have no idea what artificial intelligence can do in healthcare. So we need to tell them what we want and how they can help us. This is why recently here at the University of Mannitoba, we start to collaborate with Ahmed Ashraf and his artificial intelligence lab. And we are actually running a couple of projects, one in adult surgery and another via on oncology surgery, and we hope to come up with some good data soon. In terms of what to expect, nowadays, basically artificial intelligence can be used in the field of pediatric surgery, but also in the field of healthcare, generally speaking, mainly for prediction and helping out with the decision-making process. I look at that, what we have specifically for pediatric surgery, we are a bit behind comparing to other specialties. Nowadays, probably the best one are radiology and pathology. There is, of course, other that are catching up, like adult general surgery. But for our field, this is what I found recently. So I found a study on mainly on Ursprung, one from histopathology point of view. There is a group from Israel that they realize a pretty good model using artificial neural network with high accuracy, about 96%. And basically, they were able to make the diagnosis of Hirschsprung disease on slides. And see, this is basically histopathology kind of data. Another one that I found from China is basically to identify to recognize the Hirschsprung disease on contrast enema. Both paper, as you see, they don't have a huge amount of patients, 95 for the Israel one, and just over close to 70 in the Chinese one. Somebody could argue that is not enough. This is something that we can discuss during our question and answer session. There is the concept that for artificial intelligence, you need to have a huge amount of data, especially when you're going to train artificial neural network. This is true.
Giuseppe, I think we are getting. Yeah, I think it's. This is very, very interesting, especially now that you're touching on pediatric surgery. But as you said, maybe we can discuss this during the.
That's fine. So just one more paper about diagnosis. Yeah, I'm done. So I hope you have a bit more a clear concept about learning method and artificial intelligence and how basically this technology can help us in our field. Thank you so much.
Thank you.
Thank you, Giuseppe. That was great. I could have listened longer, but we need to switch at the chance and then start the discussion, because I'm sure there are a couple of questions, but we could all feel like you're the very expert in that topic. Okay, so the second speaker of tonight is Richard Keijzer. Dr. Keijzer is a good friend since many years. He received his MD with honors, PhD medicine and molecular medicine from Erasmus Hospital University in Rotterdam, the Netherlands. Before he started his specialist training, he did a one-year research fellowship in a lung biology program in Toronto's Sick Kids, and he received training in general surgery then at Erasmus and did a postdoctoral fellowship in physiology and experimental medicine at the Hospital for Sick Children in Toronto. He then finished his pediatric surgery residency training in the Netherlands and completed a pediatric endosurgery fellowship in Children's Hospital of Alabama at Birmingham, UAB. Since then, we are friends because I was his successor at that time in that endosurgery fellowship program. And this is where we met the first time. I bought his car, a Hyundai Accent, which turned out to be a pretty reliable car, actually. And then I sold it, I think, for the same price. So there was a good deal for me also. So subsequently, after the endosurgery fellowship, he moved to Canada with his family to pursue a career as a surgeon scientist at the University of Mannitoba and the Children's Hospital Research Institute in that institution. His clinical interest is pediatric MIS, and his research focuses on the molecular side on congenital anomalies in general, and especially CDH, and with its abnormal lung development. Ultimately, Richard hopes to develop a prenatal therapeutic intervention method to modulate the natural course of this disease before the babies are born. And his group and our group are really have a great collaboration, very fruitful, and some of our fellows have benefit from spending time in Richard Keijzer's lab. He's the Torxton Chair in Surgical Research and is the Director of Research for the Development of Surgery at the University of Mannitoba. He's the first pediatric surgeon scientist funded in the Canadian Child Health Clinician Scientist Program. And in 2018, he became the head of surgery in Health Science Center Children's Hospital. So really going up the ladder of the career. And he is, in 2021, the James Ford Traveler for Canada. Wow, Richard, this is a lot of accomplishments. It's a great honor and a great pleasure for us to have you with us this morning for you, tonight for us. And yeah, we are curious what you want to tell us about AI.
Thank you, Professor Lacher. I'll just start sharing my screen. Good morning, good afternoon, and good evening, everyone in the world. Thank you for having us today. I do have to declare upfront that parts of this presentation were developed with the help of Bing Chat using ChatGPT 4.0, and that pictures came from Unsplash, and that it was presented before during ISPSR in Milan in October 2023. So I'm also going to go a little bit into the introduction of artificial intelligence, which has been really well explained by Dr. Retrosi before, but it defines machines that are thinking and learning like humans to simulate human intelligence. And then ChatGPT, which I'll focus on a little bit more, is a large language model using deep learning via natural language input. So alternatives to ChatGPT are Google's Bard and Microsoft Bing, although Bing is now using ChatGPT after it was acquired. So large language models can review large amount of text and then learn how the words that are in the model relate to each other. And then after that, it can respond by generating similar human-like text. So the model is not actually reviewing what it's putting out. It's just producing text that follows logically based on the previous words. So that's a big caveat. You have to make sure that it's actually accurate what's coming out. So there's no guarantee there. So ChatGPT was developed by AI Research Laboratory, OpenAI, and it started as a nonprofit, but partnered with Microsoft in 2019. And then GPT stands for Generative Pre-trained Transformer. So the original ChatGPT that came out last year only had 1.5 billion parameters. So you have to pay good attention here. So it was introduced to the public in November 2022. And then in the spring of this year, ChatGPT 3.5 Turbo was opened up to the public. That already had 175 billion parameters. Then recently in the summer, ChatGPT 4.0 came out, which also accepts images for input. And they don't even know how many parameters are in there, but they're speculating that it's around 100 trillion parameters. So within 8 months, it's gone from 1.5 billion parameters to 100 trillion parameters. Now there's also DALL-E for image generation. And as you can imagine, the larger the number of parameters, the more human-like the conversations are going to be. So it's using an API, which stands for Application Programming Interface, for easy access and quick responses. So a little bit of history. AI was first used in surgery in 1980, and the first robotic surgery was performed in 1985. It can be used for laparoscopic and robotic surgery. And as I mentioned, ChatGPT was opened to the public in November 2022. So some of the uses in healthcare that people are experimenting with or actually already applying is, for instance, help with an electronic medical record or the production of clinical notes, summarizing patient data, literature research, searching large data sets, summarizing large data sets. So we all know, like if you have a patient that's been admitted for about 8 months and you have to write a discharge summary, that can take significant time to produce that discharge summary. ChatGPT would probably be able to do that within a minute. So it can generate text based on the electronic medical record and patient data and analyze these large data sets. So it can help with making a diagnosis based on input of a history, physical imaging, and laboratory results. It can help with patient education. It can help with real-life translation. It can be used for trainee education. So, for instance, generate multiple choice questions. And then as an example, ChatGPT was able to pass the American board exams, USMLE, step 1, 2, and 3, without any specialized training. So just based on all the information that's available to it. So the potential for use in pediatric surgery is that it can be more accurate and precise. There maybe going to be less mistakes. It can reduce the operative time because of that. Better recovery for patients, improved outcomes for patients, therefore better quality of life. It can be used for preoperative planning using imaging. If you feed the imaging into the system, it can help with better planning and other patient data. It can predict potential complications and outcomes before you start on the surgery. It can personalize treatment plans based on patient parameters, but also based on potential input from the surgeons, and it can help with patient education. Intraoperative, if we get to a system where there's going to be real-time guidance provided based on feedback that is coming from surgical technique or patient parameters, it can help with identifying anatomical structures, for instance. After the surgery, it can help with monitoring patients. If the patient data that is collected in an ICU, for instance, would be fed into the system, it can help personalize treatment plans based on these data and can help with patient management, and it can help with patient education and support after discharge. So Dr. Retrosi did a study here that he presented recently in Montreal during the C-Case conference, and he asked ChatGPT to answer pediatric surgery-related questions for 4 major pediatric surgery diseases. And ChatGPT was first used to generate answers to the questions, and then they were reviewed by the research staff, and then the answers were compared to what a pediatric surgeon would think would be a good answer. And 12.5% of the answers from ChatGPT were very good, and 77.5% were good. So I want to do a little demo on using ChatGPT in Bing. So I asked it pain in the right lower quadrant, fever, and leukocytosis in a child. And then this is what it came up with. So you can see it's pretty much presenting you with a textbook chapter answer on acute appendicitis. So you can imagine what's going to happen if parents start using this and coming to your operating room with all this information and how you deal with that. So it provides alternatives if you need something else. And then it talks about the surgery, different types of surgery, potential prognosis. So a lot of information. And then it provides a disclaimer that it's not a medical professional. So then I asked if it can help with some multiple choice questions for medical students. And it came up with some pretty good questions that you would be easily able to use when you're having medical students on your service, and it's providing the answers as well. So this is all on your iPhone available. Like if you download Bing from Microsoft, which is an alternative to Google search machine, you can pretty much talk to it and use ChatGPT 4.0, so the most expanded version, and it will start to give you these questions and answers. Then I asked, can you write a one-page summary to educate families on this disease? And typically, if you would have to develop this now in real life, it probably requires a committee to start writing it. It probably requires a couple of committee meetings to actually agree on the text. But this was done within seconds. A one-page summary for patient information on acute appendicitis. And it's pretty accurate if you read it. So again, a big help potentially for how we provide service to our patients. Okay, and then the last one I did, since I like to do research, I asked, can you help me with some ideas for a research study? And surprisingly, within seconds, it came up with some pretty good ideas of what could be done as a research study. So there's so many different uses for how you can potentially integrate this into your clinical practice, research practice. Or, as I say, like if patients and families are coming into your clinic or in the ER, you better be able to work with this because they're going to bring you a lot of information, have a lot of information available to them that you weren't necessarily having to use before in your interactions with patient and family. Okay, a few more slides and then we'll do some question and answers. So future considerations, I think is going to play a big role in analyzing large data sets, helping us making sense of all the data that's available to us. It can therefore help reducing surgical errors, improving outcomes, help with surgical training, help with surgical innovation. And then, as we just saw, it can potentially also help with manuscript writing and grant writing. There are some limitations, and Dr. Retrosi mentioned that. There's bias because the learning was based on training data sets and human input. So there is definitely possible bias in there. There's some privacy concerns when you're using public servers and APIs and using patient information. The security of the data, informed consent. Do you have to tell patients that the data will be used for this? So there is good human oversight required, and then copyright. So this is a famous study that was done with a smartphone application to detect malignant melanoma. And when they did the study, they found out that the algorithm was starting to think that anytime there was a picture with a ruler in there, that it was a malignant melanoma. So you have to make sure that you look at the data and you look at the output from the model, because it can be tricked into providing the wrong answer. So the limitations, legal implications, privacy, and plagiarism. So you have to acknowledge that you use this technology. And so there have been discussions within journals on how to acknowledge the use of ChatGPT for writing manuscripts or grants. So we'll have to see where that leads to, but it's an interesting new development. So thank you very much, and we'll open it up for discussion now. I'll stop sharing my screen.
Thank you, Richard. That was great also. I really liked that demo. Although I knew that this was kind of possible, it was shocking again to see the accuracy also. And I can really picture to have very educated parents in the ED looking at you. However, I think a good surgeon should not mind educated parents. So you should always be possible to argue with them. So I guess my first question would be, before people are ready to put their questions in the chat, is looking at all that what the Bing gave you on appendicitis. Do you think any guidelines we are working on? You know, right now we are working on EUROGEN ARM guidelines, and we travel all over Europe to meet and gather together in meetings. And do you think this will be like totally unnecessary in the future? Like 5 years from now, will we have guidelines, or will we just?
You should probably ask ChatGPT, can you write a guideline on the topic, and see what it comes up with and compare it to what has been done before. To be honest, if I see how fast it has gone in the last year, I think 5 years really long, Martin. I think you better hurry up with the guidelines, because I think it's going to be obsolete pretty quick.
Good answer.
I also think that's what Giuseppe said, garbage in, garbage out. It depends what you put into the. So I think that it's going to be, yes, the machine doing all of that, but at the same time, there should be still some input from our side. And I think we're not there yet with maybe the research or these more. Where you need also some critical thinking. Maybe we will get there, and then we will close our labs or our research enterprises. But what is interesting is what Giuseppe showed with the pneumothorax, for instance, or ganglion cell presence on histology samples for to rule out Hirschsprung's disease. There's a question in the chat. Yeah. It's an anonymous attendee, so we don't know. It says, thanks, Dr. Keijzer, for the great presentation. Can you speak about the use of ChatGPT with research and paper submissions for IRBs? So the research, the call in Canada, REBs, and then great use with medical records. However, what about the risk of confidentiality issues?
Yeah, so I think, thank you for that question. I think it's going to happen, and you can see how some universities are, for instance, struggling with this. Some universities stimulate their students to use ChatGPT to do certain assignments, and others are trying to prevent it from happening. I do think it's going to be hard to hold it back. Like, if people see the value and the potential, it's hard to argue to say, well, we're going to spend like 3 days writing something that can be done in 5 minutes if it's available to you. Like, people are going to find a way to use that. So I think you have to have some guidelines. And at the same time, I'm not sure if there's anything wrong with that. If you can spend your time reviewing that before you submit it and acknowledge that you've used it, then it would probably be up to the IRBs to make up their minds and say, well, what do we accept here? But I compare it to the use of a calculator. We're not necessarily asking people to not use a calculator or not use a computer anymore. So this is just a new development. It's going really fast, so it's hard to keep track sometimes. But I do think we'll have to just work with it and follow the flow a little bit. And one more thing, sorry, Giuseppe, that second piece, like the medical records, as Giuseppe was saying, like Microsoft is all over this, and they're really trying hard to get into healthcare, especially with Microsoft Teams, and they have found a way to do this in an organized way, allowing for privacy. So it will come pretty quick.
So if I can just quick comment about the integration, things are already happening. Epic is integrated ChatGPT into Epic. So I think in the States I work, I don't think it's out yet in terms of FDA approval and other stuff, but that is coming. That is gonna help out with the billing. So you just ask ChatGPT to bill, and because it's connected to the data into Epic, it's gonna bill. The short summary, everything is gonna happen. It's just a matter of time. So this is why I think is, even if we don't like the concept, I think we need to be familiar with that because it's gonna come. Second, about the validity, I think we need to keep in mind that artificial intelligence use a probabilistic approach. In the large language model like ChatGPT, we have the feeling that the system is thinking, but it's not thinking. It's working and give you the answer using statistics, basically. So basically, what's happened, ChatGPT, I think, is able to handle 128,000 tokens. Tokens, basically, each word, each symbol, even a space between each word. And normally, they analyze 3 or 4 tokens at each time, and they put the most probable word after that. Like if they're gonna type email address, they know that they got augusto.zani@gmail, and after probably you need to have a .com after. Is how basically the system works. And this why we need always to check what is coming out, because it's just a probabilistic approach. There is always a small chance that is wrong.
But I mean, I think that's really interesting. Also, what Richard said regarding it's not all bad. And now, Giuseppe, you say discharge letters. I mean, what do our residents struggle the most writing these discharge letters, right? At the end of the day, they are frustrated because they are sitting on the ward writing the discharge letter. If this is taken from our shoulders, that's definitely something good, right? So
yeah, there is a talk, especially was one of the last lecture in my course about artificial intelligence as a tool to avoid burnout in medical field. So basically, they think that when you take all the tasks that can be automated, they're gonna save you time, and basically you can use your time for speaking with patient more, to do more research, or simply to enjoy more your life. This is what they think is gonna come.
Or write a paper with ChatGPT, for example.
Yeah, no, but this is a very important. You know, we surgeons don't think too much about this because we are. It's normal to be busy and we like being busy, but definitely there is a potential. If you look at the advantages, there is definitely some challenges and something that I'm personally a little worried about. But in theory, there is a potential for reduced burnout. For increased also availability for, as you said, communication with patients, but also doing more surgeries. If I have to stay less in front of my computer, I can see an extra patients in clinic. If I don't need to type my notes and it take longer, and then in theory, an improved work-life balance, which is something that everyone talks a lot about, and I think it's important always to keep in mind. There's some more questions on the chat, Martin.
Yeah, well, Tama Yassin is asking, does the ChatGPT provide the same answer if asked on a certain topic by different users? And will other AI platforms provide the same answer? I don't know who wants to.
I think, Retrosi, you studied that. You should answer.
So the short answer is no. So you don't have always the same answer at the same question, because we also did in the study, and we probably hopefully going to publish a more extensive work soon. But you can generate more than once the answer to the same question, and most of the time is slightly different. Okay, so this is what they not keep in mind. One thing I can anticipate: not every large language model is good at the same level. There are a lot of things, like one of the limitations that now you need to consider for ChatGPT. The knowledge is updated 2021. They said that they're gonna update the system with the 2023 data soon, but that is a limitation. Other large language model are online, like Google Bard, but doesn't mean that be online is a guarantee to perform better. The important thing is how big is the neural network that they use it, and probably ChatGPT right now is the biggest one.
Augusto, next.
Yeah, there's another question. What about the risk from Sergey Minev? We have he wrote it on both the Q&A and the chat box. How much time do we have to stay ahead of artificial intelligence in the manual surgery field?
In the manual?
In the manual field, you know, with the manual dexterity, thinking about robotic surgery and robots in general. I don't think that ChatGPT will do our surgeries, but there will be other platforms, obviously.
Do you want to answer, Richard? Or
yeah, sure. Yeah, I think like it's going really fast, I must say. Like I heard about it last year, end of the year, and then if you see the progression since end of last year and this summer, it's been really fast. So I think a lot of it is happening in real life, and I think most threatening is probably like making a diagnosis, like the medical profession, or like radiology or pathology, where you can really feed the model and it can help you come up with the answer. Surgery is a little different, but having said that, with robotic surgery, it's probably going to be possible at some point to have a lot of the steps done by robots. And I just wanted to answer the other question from Dr. Miniev. How can we train our residents using AI? I would turn it around. I would probably say we should ask our residents to train us in AI, because I think they know, like they are using this. Like I talked to my son, he's 20, he feeds some of his study text into ChatGPT for summarizing, and no issues, no thinking about it. So I think they're way ahead of some of us.
Yeah, I don't think we need to be afraid too much about AI taking over on us especially in pediatric surgery, mainly because I think in Boston at the last American College of Surgeons there was a panelist that was speaking about the topic, and there is a study on laparoscopic cholecystectomy. They are aiming to collect 1,000 video to basically train a model to recognize basically the critical view and help with the decision-making process in the OR. However, let's think about our field, esophageal atresia. How much time is going to take us to take 1,000 video on thoracoscopic esophageal atresia? It might come, but it's not going to be anytime soon, because we need to have feed a lot of data into the neural network, and video analysis is not a simple task. It's pretty common, so you need really high quality video to perform that.
So in this respect, what do you think, like in decreasing order, which specialties will vanish first? I mean, you've showed some dermatologist-like slides. Richard pointed out that the ruler is a dangerous tool also. So maybe it's dermatology, radiology, and then pathology. Or who in which disciplines would you recommend not to specialize if you could recommend something to your kids?
I think that's hard to say. Like it didn't mean when we were starting to use a calculator that we're not doing math anymore. So I'm not sure that just integrating ChatGPT and AI into our specialties is necessarily gonna get rid of them. I think we'll probably have time to focus on other things. And it also talks about like the loss of jobs. I think if you work with AI and ChatGPT, you're probably not going to lose your job. You're probably going to find a way to be better at your job or your specialty. So I think I would approach it like that. I wouldn't necessarily be afraid. I would just try and take advantage of it and use it to get better patient care for pediatric surgery.
I think here we are missing up an important point, that machine learning works well when there are data that the machine can analyze on something that we already know. Everything new, machine learning doesn't work. COVID was a good example. So and now that we got a lot of data, but at the beginning, everybody was struggling. So I think I don't have, I want to say, these are personal opinion. I don't think we're going to lose job. Definitely we're going to need more data scientists, more data analysts. So definitely somebody starting a new career in a field, this is a good field to go. I think radiology, surgeons, and pathology, they're always going to be there, because we need still to validate and to make sure that things are done properly. And when there is something unexpected, well, that's when the human intelligence has to kick it in.
It's interesting. I used ChatGPT to ask. We implemented the Surgeon of the Week model here in Toronto, and so I was looking at the advantages of having a rounding system and what ChatGPT thinks. I wrote down my opinions, and then I looked at, and of course it was much better in, at least in English, what came out. But also there was a caveat saying that there was no input around this topic since 2022. And so what Giuseppe is saying is really true. It very much depends on the data that are available to the platform. And if it's not updated, if not, the specific topic, then they will try. It's a probability. They will come out. Will come out with something that is very, very close, but is still not necessarily 100%.
Yeah.
There's also a question from Dr. Bagolan from Rome. I also tested ChatGPT, says, to get advice on how to start delicate discussions about invasive or palliative treatment with answers consistent with our way of thinking. But can AI really adapt to thoughts as diverse as ethical ones? And I have to say, it's interesting because, of course, very much depends also where you are in the world. And ChatGPT, I think, is only in English at the moment. But obviously, in other countries, also the mindset and the ethical considerations will be very different.
Oh, but I mean, Google Bard, for example, is in German also.
Yeah, but the fact is that it's producing text in German means that probably is using German data. So if you think how much data is in English and how much is in other languages. So in terms of amount of data, the English one are by far much more than anybody. And this, I think, is a good comment, Augusto. And I think for the specific topic mentioned by Dr. Bagolan, I think a good human component needs still to be. We can probably ask advice to ChatGPT, but we need still to elaborate by ourselves to adapt.
But again, I think it depends on the data that has been fed into the system, because is a philosopher or an ethicist able to oversee everything that's ever been published in ethics and take that into account? ChatGPT probably would be. And so then if you work with ChatGPT, you could have more insight potentially, because you can oversee everything that's available. And I wanted to mention one more thing about the, I've had concerns about that it's all historical and not necessarily able to predict. I think it is pretty up to date now with ChatGPT 4.0. But there is another layer apparently coming within the next 1 or 2 years where it becomes self-learning. And that's why some people get nervous, like if you read the news where they say, well, like robots are going to take over our lives and everything. That's where some of that concern comes from, when there is no need for human input or interaction with the algorithm to feed it information, but it can feed itself. That's why they think it becomes tricky. So I think that's in the background coming, where there's going to be another layer of self-learning.
Good. Then there's a question from Hussein Naji. We talked about loss of jobs already. Loss of truth, as someone can imitate you in an avatar. So loss of truth is one question, and the other question is loss of competition between the trainees, because some may use AI and some may do not. So truth and competition. Any comment?
So I think the artificial intelligence is out there, so we need to learn how to use it. There is, I think we cannot avoid that. Loss of truth, it depends, because technically, like let's say I'm writing up a paper, and normally you should acknowledge if you use a ChatGPT or not. So it's really up to us, but even nowadays, when you publish a paper, who's going to check if your data are true or not? So it's same kind of thing. So it's a difficult question for sure. I don't have the real answer, but I think we need to, this is a good reason why we should understand about artificial intelligence, also to protect ourselves.
I know also, I heard, I don't know if this is true, but this topic is so hot these days. So I've heard also other panelists in other forums. And one of the things is that the major publishing companies are now in a way able to recognize whether an article has been written with ChatGPT. I don't know if this is I don't know, like Nature, Springer, these big publishers. However, ChatGPT is not the only platform. There are other platforms, and as you can imagine, it's very difficult for also the publishers to keep up with how fast people, the scam in any aspect of life, including obviously research and plagiarism.
Yeah, so I think it's a fascinating question. I think if you step out of it and think about what are we trying to do with this article, right? We're trying to convey information to the public and to people that are interested in that. To me, it doesn't matter if I spend 5 weeks writing that, or if I use ChatGPT writing it in 5 minutes, because then potentially I can use it for something else. I could see how journals struggle with that, but maybe this would be a disruption that would actually be bigger than open access, where you would just have this information all out there, and maybe journals and writing manuscripts are a thing of the past pretty soon.
There's a question from Dr. Jafrul Hanan. How can we use AI to train our residents? So, Richard and Giuseppe, how do you use it right now?
So, do they do in that institution, or they are planning to do it?
No, the questions are: what are you like? How can we train our residents using it? And what do you?
You can, because I think we had recently even a guest speaker here at University of Mannitoba from McGill University, Professor De Maestro. He's a neurosurgeon that is close to retire and is using artificial intelligence in the simulation center. So basically, you can use to identify talent, to analyze all the metrics on the simulators, because the thing is, an artificial intelligence model is able to identify patterns or in a way that no human being is able to do it. Right now, when we identify and try to define expert in surgery, we basically analyze a few parameters like time to perform the task, economy of movement, and error, and so on. We are gonna, so there is evidence that a human being can deal with 6, 7 of these kind of parameters, while an artificial intelligence model is like 1,000. So is able to be even more precise to define the surgical performance. And this is happening already. There are pretty good amount of publications, especially from McGill, from this colleague, and that is using a model to identify partners and to define expertise, basically to identify who is going to perform better, who is going to become a better surgeon, and so on. Is that?
So this will definitely then, if I get you right, influence careers, right? So the AI tells you, you know, there's like 0 talent, access denied to the trainer, for example, right?
But still need to be filtered by some human being.
Somebody else. Richard, how do you use that in training at your institute?
I don't yet, but I've read and I could see how, for instance, like we loved looking at the drawings from Nether, right? Learning our anatomy. What if you have live feedback while you're operating that you now sometimes get from the people that train you, but from an AI system, and saying, well, you're dissecting close to the recurrent nerve during thyroidectomy. And it would warn you up front because you're closing in, and there would be data coming from the patient. So I could see use for that, where you're not necessarily sitting behind your books. You're not necessarily doing the sections on cadavers, but actually real life, you're getting feedback in training. And I think that would be beneficial, because then you could spend your time on other things again.
And I can add, like in our morning conference, our radiologists, they use the AI to identify fractures on an X-ray. So there's always the fractures already in that growing skeleton, which alters with all, you know, the different variants. And also they have in neonates, they have an app called Clearview that subtracts all the ribs, so you can look directly on the lung. And then sometimes in a neonate, you would see a CPAM that you would not recognize on a conventional X-ray, but if the lungs are not in the way anymore, and this is a training this is an app that had been already trained. So I think in daily practice, they are using it.
Yeah. That's cool.
I think that the important part there is that then they still look at the images, and they then you know accept or not the whatever the machine says. And this is, you know, we have so many.
I want to just add one thing on this, because did your university develop the model for reading the X-ray, or?
No, this is a tool. You need to buy the license. It's called Clearview. That's a company who sells this license.
Yeah, there is one important aspect that can be applied to X-ray, and also to like other model that work on prediction and so on. A model, it might not work for every institution, because you might have different data, different population. And when I started, I thought, well, X-ray is going to be the same everywhere in the world. And I figured out that it is not, because plain X-ray, they are good to our eyes, but different machine, different brand, they might have a different quality and different number of pixels. So you might have that the performance of that model is not going to be excellent if you move to another institution. But what you have to do, you might need to retrain the model with the data from that institution to come out. And even like model more for, as I said, prediction, and to understand the trend of disease in population. If after 5 or 10 years you got like a massive immigration in your area, and the population is completely changed in terms of demographic, you might need to retrain the model to optimize the performance.
Mm-hmm.
Next question is from Manoj Joshi. Scope, limitations, and challenges of AI need to be included in medical education. What shall be the legal implications about validity of machine learning materials over experience of a medical professional in a clinical decision? I think we've gone over this.
Yeah, I think that that needs to be regulated somehow, right? And I think the danger by everything going so fast is that there's not enough time to actually think this through and come up with good legislation. Another interesting example I heard about is that a lawyer somewhere produced his case using ChatGPT. And including references and everything. So a big document. And then it was found out that the references were completely off and completely wrong and not referring to the right text. So that case completely failed. So at this point, you still need human kind of checking of things. And I think it's getting better and better. But there needs to be some guarding of the information and making sure that we're not just making things up. Because as both Retrosi and I said, the algorithm is not checking it. They're just spewing out words that seem logical in the order. They're not thinking about the answer.
Yeah. So this is called hallucinations.
I think, Richard, you're touching on a very important point. We are only talking about AI in medicine or surgery. That's almost an easy task. If you go to all the lawyers and the legal implications, there are ChatGPT, if these tools respond to a judgment that has been on the court, just to entertain that court back and buy you some time, and these machines do it in seconds, right? This will create then another lawsuit just to prevent you from paying the bill, right? So they have, I think, bigger problems than we have, right?
Yeah.
Augusto, what do we have left? There's one question from Yasin. What do you think the caregivers think if they would know that we are using AI to treat their child?
Well, I haven't spoken to parents about that, so to have to ask them directly. But I would imagine that it would be the same as me saying, well, this has been developed by a committee from the hospital. And now I could say, well, this has been developed by ChatGPT, but it was quickly reviewed by the committee that previously wrote these guidelines. So I think you just have to be honest about it. There's no way of hiding it. I think you just have to be honest.
I think by the time you're going to use it regularly, I think the general population will be so much familiar with other ways of using ChatGPT that it will be sort of second nature.
And I think Microsoft is well on its way to integrate it into Microsoft Office. Apparently that's coming out soon, where every program in Office that you're using, and most places still use that in the office, in hospitals, will have a co-pilot, they call it, which is based on ChatGPT, and that will help for generating text.
Last question on the Q&A box. This is from Agata Kawalic, I think. Sorry if I pronounced it wrong. I have a question about the verification of the answers given by ChatGPT, because these also can be time consuming. Who or what type of programs will be able to do it?
I don't think there is any program that is able to do it. These are tasks that we have to do by ourselves. And this is basically the hallucination effect that you can have because the system works with a probabilistic approach. So you have to validate your. I will discourage to copy and paste and submit or send whatever the text, because the system, it's called artificial intelligence, but it doesn't think really. So we need to check on that.
Well, there was an interesting newspaper article in the Globe and Mail, one of the Canadian newspapers, a few weeks ago. When this all started, they hired people to check the answers. And it was pretty low income, pretty boring work. They would get thousands of answers they would have to check. So that's where potentially mistakes have got into the algorithm. If someone was just bored or just done with it for the day, they could have provided the wrong answers to the algorithm. And that's getting better now with so many more parameters but especially in the beginning, that was a big issue.
Okay. I guess we covered it all for now.
We were at almost 100, actually around 100 participants, and then this webinar will be, as all the other ones, cut and uploaded by Professor Lacher on the EUPSA YouTube channel, so everyone can watch it again and enjoy it at the later stage.
Great.
Thank you very much for having us.
Thank you so much for the opportunity. Thanks.